So good evening, everyone, and thanks for the kind opportunity. So, in fact, due to the limited availability of the data on the therapeutic use of prisms in the strabismus, we thought that we'll just evaluate our own data. So we retrospectively studied cases of strabismus managed with prisms seen at three of our centers in Delhi NCR over a period of 5 years, COVID era included, who had more than 6 months of follow-up. So these were cases of strabismus who were managed with prisms, both Fresnel prisms as well as the ground prisms. So we had the success measured when they had responded to the prisms by resolution of diplopia, or the alignment led to the binocularity restoration and the uh, betterment of abdominal head posture. So 120 of 154 patients were included for analysis, and they had a mean age of 7.6 years and mean follow-up of 13 months. Majority of these cases were managed with Fresnel prisms, which are stick-on prisms that you actually put over the glasses. So sharing some of the interesting cases, we had this gentleman who was managed with Fresnel prisms for his right lateral rectus paresis for diplopia relief. Another case of partially commutative esotropia, where segmental Fresnel prisms were applied over the distant segment of the bifocal to manage and preserve the binocular vision. Then we had a consecutive esotropia and hypodeviation, which was managed during the COVID period for almost 2 years before a definitive surgery could be done. And an innovative oblique placement of the Fresnel prisms was tried in one of the case, where the case was of bilateral Duane syndrome, and this helped in betterment of the abdominal head posture. So most of our cases were esotropes, and the better outcomes were seen in intermittent exotropes and cases which had lesser onset of deviation. So just to recapitulate, the Fresnel prisms is a stick-on prism, which is a thin transparent sheet, much thinner and lighter compared to the regular ground prisms. So this therapeutic use of prisms has been studied earlier, but ours was a larger series and had a much younger profile, with 7.8 is the mean age, and 78 out of 120 children were cases were children. So we had included binocularity as one of the criteria for success, which has not been done earlier. So this was a major plus point of the study. The limitation of the prisms was the cost, the intolerance to prisms, and the uh, temporary intervention method. So, in short, the usage of the study was that eye care personnel anywhere, even at remote locations, can actually use prisms as a stopgap measure to treat strabismus. And the conclusion that we had from the study was that in selected cases, the prisms are an effective non-surgical option that we can use to manage many cases. Thank you very much.
Uh, and did you find any association between the etiology and the type of prism which you were using?
Yeah, so actually, since we had a broader success criteria, many cases of esotropia already had a poor binocular vision. So those responded a little less. That's why our success is probably less than what has been reported in literature. But we wanted to determine the efficacy overall, and as a methodology, to help in the restoration of the alignment. This was an excellent method.
Right. Thank you.
Thank you, ma'am. Thank you very much.